ketogenic diet healthy or safe for women? Let's talk about it. My name's Dr. Ruth Dutton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, meaning that I look at the overlap between mental health and metabolic health. And one of the most powerful interventions that we have is using a ketogenic diet or ketogenic therapy to treat serious mental illness. However, there's a lot of controversy about whether or not the ketogenic diet is good or safe for women, and with good reason. Let's talk about what the data shows. So we do know that in perimenopausal women and in women who have metabolic dysfunction and hormonal issues like PCOS, the ketogenic diet can actually be really helpful for combating the metabolic dysfunction and for regulating hormones. It can help with perimenopause symptoms. It can help regulate a period for people who have PCOS. Of course, it can address things like insulin resistance and for some inflammation. However, in menstruating women who do not have pre-existing metabolic dysfunction, there is some evidence to show that it can actually cause menstrual irregularities. Now, this doesn't happen for everyone, and there's definitely an element of bioindividuality here. Some women have been on carnivore since they were young, meaning very limited to no carbohydrates, and they've done completely fine. Other women start a ketogenic diet and it causes menstrual cycle irregularities, or they might lose it altogether. So the fact is that for menstruating women, a ketogenic diet or carbohydrate restriction is a stressor on the body. Now, there's something called a hormetic stress, which means that it's a good stress on the body. So this happens when people exercise, right? It's hard, it's stress on the body, but ultimately your body gets stronger because of it. Or for some fasting can be a good stressor on the body that leads to improvement in metabolic health. However, it's important to keep in mind with women that their hormonal cycles are very sensitive to stressors on the body. And so if there's too many stressors being placed on the body, then your brain is essentially going to tell your hormones to stop inducing a period because you need to conserve your energy for this stressful state. So what are things that can cause stress on the body in addition to a ketogenic diet? So this could be things like intense exercise or a really intense fasting schedule. Or maybe just there's a lot going on in life stressors. Or maybe they're dealing with an injury or an infection and the body is trying to deal with that. So when it comes to women, you have to think about what are all the cumulative stresses that are on the body right now, and is a ketogenic diet going to tip them over the edge into being in hormonal dysregulation? Now, there are things that you can do to decrease the amount of stress on your body. So one would be not fasting at all, right? Don't limit how many times you're eating throughout the day so that your body's not perceiving at any point in time that it's in a starvation state. Don't engage in intense exercise. Make sure you're prioritizing sleep and stress management. And for women eating more high fiber foods, so like low carb vegetables, think broccoli, cauliflower, asparagus, zucchini, celery, etc. That can actually be really helpful for gut health, for making sure that they're getting all the micronutrients that they need. And for some women, they do better with carb ups, meaning for that week before their cycle, they increase their carbohydrate intake, potentially making them exit a state of ketosis. And this helps them to eat more with their hormonal cycles. A couple of times when I would absolutely not recommend a ketogenic diet is if you're pregnant or if you are nursing. Now, with the nursing, it's mostly that first 6 months of nursing where baby's really exclusively dependent on the breast milk and where your body has to provide a lot. But after that, depending on the individual, they could think about carb restriction or a ketogenic diet. One final piece of advice that I would give is, and this may be controversial, but if you're thinking about going on a ketogenic diet or you are on a ketogenic diet, then I would generally recommend not taking hormonal birth control so that you can actually use your menstrual cycle as a proxy for your overall health and balance of hormones. If you're taking a hormonal birth control that either regulates your period or eliminates your period altogether, then you can't really know if what you're doing is disrupting your physiology. If you're a woman and you have in the past or are currently doing keto, I'd love to hear about your experience, if it helped to regulate your cycle or if it caused irregular cycles. Please share in the comments below. I think we can all learn from each other. Wish you all good mental health today, and I'll see you in the next one.